everyone. My name is Julia Moseri, and this is my presentation on white middle-aged men, suicide risk, and interventions. Throughout this semester, I have been researching the population of middle-aged white men, and these are some of my findings. Middle-aged white men are at an incredibly high risk for suicide when compared to similar groups. Similar groups are men of different ages or men of different races or women. This particular population is impacted by unique circumstances that lead to high rates of suicide attempts as well as dying by suicide, and I am going to go through those unique circumstances throughout my presentation. The need for addressing the suicide rate within this population is very recently becoming much more prevalent in both science and literature. Overall, understanding the impact and the causes of this high rate of suicide is necessary for developing life-saving interventions for this population. This population has very specific needs, and the interventions must reflect those. So here are some numbers about this population's suicide rate. 70% of suicide deaths in 2021 were white men. 50 out of 100,000 middle-aged white men die by suicide. This group makes up only 19% of the overall population, yet accounts for 40% of deaths by suicide. Along with this, the suicide rate in this population is steadily increasing. Because of this, developing interventions for this population is very necessary. Thomas Joiner's interpersonal theory of suicide outlines three main factors that contribute to suicide-related thoughts and behaviors. The first is perceived burdensomeness, which is essentially feeling like a burden on others, or believing others would be better off if the individual were gone. The next is thwarted belongingness, which is having no sense of belonging, feeling alone in the world, and lacking meaningful socialization. The third is acquired capability for suicide, which is development of a tolerance to pain, or losing the fear of hurting oneself or dying through habituation. So these are some of the ways that these factors can apply to this population. First, perceived burdensomeness. Many men become physically dependent on their partners or healthcare workers, especially at this age. They may also be lacking a mental health support system or be avoiding one, which is very popular for this population. And this may place additional pressure on their loved ones, which will add to the feeling of being a burden. The next, thwarted belongingness. Many men of this population lack community. Divorce is also very common at this age. Along with this, many men may simply feel very alone. This could be due to a number of reasons, such as kids moving out, maybe they're living alone, or they're living in a rural area where they may not have many people directly around them. The third, acquired capability for suicide. Substance use is very common for this population. Along with this, the potential for physical injury and illness is increased, which could lead to habituation to pain and loss of fear. So why is this population at risk? I believe that this specific population is at risk because of three major contributing factors. Number one, high rates of firearm ownership. Number two, substance use. And number three, loneliness. And I am going to go through these three factors in detail. Number one, firearm ownership. So, the majority of household gun owners in the US are men, or more specifically, white men. Rates of suicide among those who have guns in the house are significantly higher than those who do not, and this is true for this population. When compared to similar demographic groups, such as the ones I mentioned earlier, this population is much more likely to die by a firearm-related suicide. So, overall, middle-aged white men's likelihood of owning firearms increases their annual suicide rate. The next is substance use. Substance use disorders are generally considered to be a male issue, as men are twice as likely to report a substance use disorder than women. Middle-aged men specifically are highly likely to use and abuse substances due to a number of factors, including the ones that I outlined on the slide about the interpersonal theory of suicide. Men who use substances are 6 times more likely to die by suicide than those who don't. So, substance use is a major contributing factor of suicide for this population. Finally, loneliness is a cause of this group's high suicide rate. So, loneliness directly intertwines with thwarted belongingness and can be fatal for many men within this population. Men in general are less likely to develop close friendships than women. Along with this population commonly lacks social supports outside of the home. Lack of community is also very common in predominantly white rural areas where many of these men are living. Loneliness leads to hopelessness, which is understood to be a major contributing factor for suicide. So, these are some current interventions. The first is dialectical behavior therapy. DBT was developed for women with borderline personality disorder and is an effective suicide prevention therapy. DBT can be used with just about any population, but has been directed at middle-aged white men and has been very effective. DBT essentially teaches the client effective practices for emotion control. This can be emotion regulation, mindfulness, or distress tolerance skills. DBT has proven to be effective for this population. The next intervention is gun control, or restricting lethal methods. Local and state laws regarding gun control aim to reduce suicides for this population. This could be limiting access to availability of weapons, possibly through legislation, or incentives such as firearm buyback programs. The last is a fairly new intervention, and it's online suicide prevention campaigns. This population does not like to disclose their thoughts of suicide, so these campaigns have been developed to encourage discourse about this topic. The anonymity of these programs encourages participation from this population, and this has been very effective with middle-aged white men. Currently, most interventions for suicide are reliant on the suicide individual self-reporting, which is very rare for this population, mostly due to stigma. So here is my proposed solution. I believe that the best approach to preventing suicide within this population is actually clinical. A very well-vetted intervention for this population is one through which primary care practitioners discuss suicide with their older male patients. Most middle-aged men who die by suicide will visit their primary care practitioner within weeks of their deaths. This places these doctors in a critical position for patients who may not currently have access to mental health services or may not be looking for mental health services. This intervention includes bringing up the topic of suicide and simply talking to their patients about suicide, which is not often discussed. This can be a really helpful step in preventing a suicide attempt. So implementation of this method would essentially be training these primary care practitioners on how to have these conversations specifically with this population. This intervention is simple but an incredibly effective method of suicide prevention. Most older men want to discuss these thoughts and feelings with someone, and this intervention allows for them to do so. So here are just some further recommendations for intervention for the suicide rate within this population. Number one, community outreach directed at middle-aged white men. There aren't a lot of programs that are directed at this population, and I think an increase in availability of programs such as this would be incredibly helpful. The next is harm reduction centers and Narcotics Anonymous and Alcoholics Anonymous programs becoming more widely available. Third, introducing social programs and meetings to incentivize this population to be with others. Because loneliness is a major cause of suicide within this population, having more opportunities to be social and interact with others, maybe others like them, such as other middle-aged white men, would be incredibly important in reducing suicide. Increased education about suicide prevention, essentially breaking the stigma starting in schools. I believe that talk about suicide should begin as early as elementary school to introduce this topic and to allow for stigma to not develop. Next, free access for storing lethal weapons, because firearm suicide rate is so high. Having a place to store these weapons would be incredibly important. Many towns do provide this, and I think that this should be provided everywhere. Lastly, provision of mental health screenings for middle-aged men. I believe that making mental health screenings more widely accessible would help prevent suicide for this population. So, resources. If you or anyone you know is in need of help, there's the Suicide and Crisis Hotline. Just call or text 988. You can chat with someone at 988lifeline.org. Both are free and are available 24/7. Thank you so much for watching.